Strategic clinical networks, I think, are really important parts of the NHS. They occupy a unique position. They sit in a world that crosses both commissioning and provision of healthcare to facilitate the two together, because when you do facilitate together the clinicians and the managers, then you really do begin to get some special outcomes as a consequence. So they're a very important group, and I'm lucky enough to have a series of good clinical leaders across the strategic clinical network in Cheshire and Merseyside.
We're a fairly new network. We were established just over 12 months ago, so engagement's been absolutely key. We held widespread stakeholder meetings to look at what the priorities were for patients and services for maternity for Cheshire and Merseyside. So out of those special interest groups, our stillbirth group has produced a stillbirth care bundle, which has been adopted nationally to try and reduce stillbirths across the whole country. Our preterm labour group has produced a guideline to identify ladies who are at increased risk of preterm labour. We're trying to improve patient experience, so experience for mums and their partners and their families and the babies, and improving safeguarding standards across the whole region. And from that, improve the management of the care so that if they try and reduce the risk of going into preterm labour, but if they do go into preterm labour, how we best manage that and only move ladies around the region for special care baby services, for instance, if they need to move.
So the main part of the work has been in relation to mental health. We've been working hard with commissioners and providers to ensure that crisis services are accessible. And so as an example of that, we've developed a self-harm pathway, and that's about making sure that when young people do need help, they can get it quickly and from the right person. Young people have developed self-harm passports, which means they can go into A&E or into any service that they may already be engaged with, and let the people know there what's important for them, what's helpful, what's unhelpful.
It's been really inspiring to bring together different organisations to work on common aims and to not work independently from each other. So one of the most impressive things has been being involved with the Crisis Care Concordat. I have heard time and again over the years that I've worked in mental health the difficulties people have had when they first experience problems and the difficulties their families have had in getting help for their loved one. And it's been great to get key people in the room together, including the police, accident emergency services, mental health services, to try and do that better and to try and make things much better for the people that are in crisis. Because I'm very, very keen to work on prevention of mental health symptoms, and I feel that if people had earlier intervention and the right sort of intervention much sooner in their lives, a lot of their difficulties could have been prevented, or at least not resulted in the amount of services that's been required to support the people.
We have had tremendous successes. I mean, we have taken a lot of projects over the last 10 years, really. Let me start with one of our key projects, and that was managing impaired glucose regulation. Now, essentially, once you've got diabetes, everybody knows what to do with that. That's an established disease process, and we manage it. But just before diabetes, there is a condition called impaired glucose regulation, which means they haven't developed diabetes, but they've got a high risk of developing diabetes. We came up with a whole pathway of managing these high-risk or borderline diabetes, as they're called, and pre-diabetes is other term that's used across the world for them. And this work ended up in this pathway actually showing the benefit in terms of intervention, and the intervention that we devised was lifestyle changes. And this was then launched last year right across the Cheshire Merseyside region with the help of public health and the patients and the general practices. The big issue has been diabetes foot amputations. For the last 2 years, we worked as a team and we developed a pathway that takes the patient from the day of diagnosis right up to development of an ulcer and how we can prevent it and reduce amputations. And that has been agreed now, and we are in the process of implementing this region-wide.
This next year's is quite an exciting one. The network has recognised its capabilities in change management and also improvement methodology. The SCN is very well placed because of the 5-year forward view, which is the NHS England's plan for the next few years. So that there is a clear link on the 5-year forward view, and the SCN cover most of the 5-year forward view.